Hello everyone, this is Dr. Divya. The topic for today's discussion is marasmus. Marasmus is a severe undernutrition, a deficiency in all the macronutrients that the body requires to function, including carbohydrates, protein, and fats. If you have marasmus, you lack the fuel necessary to maintain normal body functions. People with marasmus are visibly depleted, severely underweight, and emaciated. Children may be stunted in size and development. Prolonged marasmus leads to starvation. Symptoms of marasmus: visible wasting of fat and muscle, prominent skeleton, head appears large for the body, face may appear olden and wizened, dry, loose skin, dry, brittle hair or hair loss, sunken phonates in infants, lethargy, apathy and weakness, weight loss of more than 40%, and BMI below 16. Diagnosis of marasmus. Diagnosis will begin by physically examining the person's body. Marasmus has some telltale physical features, the primary one being the visible wasting of fat and muscle. People with marasmus appear emaciated. The loss of fat and muscle under the skin may cause the skin to hang loose in folds. Marasmus is defined differentially on different charts, but it is always significantly below average. To use a chart, more people are familiar with marasmus would score below a 16 on the BMI. The purpose of scoring is mostly to confirm the diagnosis and rate how severe it is. Treatment of marasmus. Stage 1. Rehydration and stabilization. The first stage of treatment is focused on treating dehydration, electrolyte imbalances, and micronutrient deficiencies to prepare the body for refeeding. Stage 2. Nutritional rehabilitation. Refeeding begins slowly with liquid formulas that carefully balance carbohydrates, protein, and fats. Stage 3. Follow-up and prevention. Since marasmus can recur, a complete treatment protocol includes education and outgoing support for the patient or their caregiver before they are discharged. Prevention of marasmus: fighting poverty, eliminating food deserts, improving nutritional education, controlling widespread infectious diseases, and improving sanitation and improving elder. Through following all these things, we can prevent marasmus. Risk factor for malnutrition: literacy level of education, and family social economic factor, feeding and weaning practices, chronic infections like TB, HIV, and cancer. Age and sex plays an important role as a risk factor, and season, weather, geographical location is also one of the major risk factor for malnutrition. To this, I conclude marasmus results from an overall deficit of calories. Food deprivation is enough to induce it, but its effects are much more complicated than that. That's because marasmus is not simply hunger, it is a series of progressive adaptation that the body makes to try to survive hunger. Thank you.